So I will start with my Pyxis. I will check the physician's order sheet with the MAR. I will note that the name, the patient's name, date of birth, and any allergies are the same for both. And then I will go on to check the medications. So I note that the Humulin and pH, 15 units sub Q, is the same for both. The Humulin R, 13 units sub Q, is also the same. And the ceftriaxone, 750 milligrams per 0.5 milliliters IM, are the same for both, and they are all to be given at 8 a.m. So now that I have verified this, I can go ahead and gather my supplies. I will start with the NPH. I will check the expiration date, make sure that it hasn't expired, and it hasn't. The regular has not expired, and the ceftriaxone has not expired either. I will then gather my appropriate syringes and my alcohol swabs. So now that I have all of my supplies, I will bring them to my patient's room. I will knock, close the door for my patient's privacy, introduce myself. So I said, hello, my name is Sarah. I'm a student with Marion University. I'm here to be administer your 8 a.m. medications. Can you verify your name and date of birth for me? Thank you. I will then scan the patient's wrist to make sure that that is correct. After that, I will wash my hands and put my gloves on. I will then raise the bed to appropriate height. I will then go on to explain to my patient the medications that should be given. So the Humulin NPH and the Humulin regular are insulins that will be given to you in your abdomen sub-Q. They are to help lower your blood sugar, and prior to giving these medications, I have checked my patient's blood sugar and it was 180, so it is okay to give these. And the ceftriaxone is an antibiotic used to fight infection, and so the patient had an infection from a dog bite, so we're going to administer this to help treat the infection. After that, I would ask the patient if she has any allergies. If not, do you have any questions before we get started? Okay, good. I will raise the bed to an appropriate height. Is there one drug that you prefer to be given first? Okay, insulin. So we can start with the insulin. So we have NPH and regular. The insulins will be given in the abdomen, 2 inches away from the umbilicus and 2 inches away from any wounds that the patient might have on their abdomen. I will first go to wipe the top of the vials. I'll grab my syringe. So I will check the MAR again, and it says that the patient needs 15 units of NPH. So after I verify it again with the MAR, I would get 15 units of air and inject it into the NPH. And I see that she needs 13 units of Humulin R. So after I check that with the MAR again, I would inject 13 units of the Humulin R into the vial. I'll then get the 13 units. Good. And since this is a high alert drug, I will make sure that I verify it with another nurse before administering. I'll then get the NPH, and the patient is to receive 15 units. So that'll be a total of 28 units in the vial, in the syringe. So after that, I would make sure I check it with the nurse to make sure that's 28. I would then cap my syringe. Oh, before giving NPH, I would roll it before injecting it into the patient. So I would let my patient know again that this is going to be injected into their abdomen, And so I would get an alcohol swab and clean the area 2 inches in a circular motion. I would grab my syringe. I would pinch the skin an inch and inject it in a 90-degree angle. Cap my syringe. And if there's any bleeding, I would get an alcohol swab and blot it. I would not rub the area because it could create a hematoma. And I also let my patient know that any bleeding or tenderness is normal with this injection, but if they have any signs or symptoms of hypoglycemia, such as shaking or headaches or sweating, to let me know. So after that, we can move on to the antibiotic, the ceftriaxone. So I see that my patient needs 0.5 milliliters of this. So I would grab my medication, and I've already checked it again with my MAR. 0.5 milliliters. So I would get 0.5 milliliters of air injected into the vial, and then bring up 0.5 milliliters of the medication, like that. I would then cap it. Also, I would clean the vial before gathering the medication out of the vial. So then I would come over to the patient. I would let them know that I would be injecting it into their deltoid area. So I will find the chromium process, which is about here, go 2 finger widths down in this area right here is where I'll be injecting. So I would clean the area 2 inches in a circular motion. I would displace the skin about 1 inch, like so, and then inject the medication. Good. I would cap it. Let the patient know that any tenderness or redness is normal, and that if they have any GI issues such as nausea or vomiting, they need to let me know. Again, if there's any bleeding, I would pat it with a alcohol swab, blot it with alcohol swab, not rubbing it because it could create a hematoma. And after that, I'll ask my patient if they have any questions before I go. If not, I'll let them know that I'll be back in 30 minutes to check on them. I will gather my supplies, my equipment, wash my hands, dispose of PPE, and wash my hands. I will lower the bed, raise the rails back up, and make sure the call out is in place for my patient if they have any questions, and I will document and leave.